We're so pleased to be back again during Bladder Cancer Awareness Month. I'm your host today, Tawny Barratt, and I'm excited today to be sharing an interview that I did with bladder cancer patient and survivor Angela Peltier that we recorded late last fall. Angela had graciously agreed to be the patient face of our holiday appeal campaign, which went on to raise thousands of dollars to support the free programs and services that Bladder Cancer Canada offers to raise awareness and fund research. I'm sharing this podcast with you today as part of Bladder Cancer Awareness Month. I think you are going to really enjoy the next 45 minutes or so as Angela talks to us about being born with spina bifida, then being diagnosed with non-muscle invasive bladder cancer, how it progressed to muscle invasive bladder cancer, and then resulted in her having her bladder removed just last May. Angela has very quickly become a legend at Bladder Cancer Canada. She is quite easily one of our most requested spokespeople. Angela has done interviews on the radio and on global news. She has recently participated in a patient panel with Pfizer Canada, where she sat and talked about her experience to a group of people that were strangers to her, and she did it beautifully. This podcast today is sponsored by Coloplast Canada, and Angela, as somebody that has used catheters her entire life as a spina bifida patient, talks quite candidly about some of the challenges that she faces as a catheter user over the years. Without further ado, I would like to welcome Angela to our podcast today. Angela, let's start at the beginning. You said that you were born with spina bifida. Can you tell us a little bit about that and what that has meant for you throughout your life?
So when I was born, my parents didn't know anything about spina bifida. And of course, 40 years ago, it wasn't something that showed up on an ultrasound either. When I came out, my spine was on the outside of my back in a sac the size of an orange. So I needed surgery right away to fix that. And there was a lot of nerve damage that happened throughout. And then my parents were told, okay, this is what needs to happen. So I was catheterized every day of my life until I had my bladder removed in May. So the surgery was actually more to put my spine back together.
Okay.
Basically, it was kind of like apart, and they had to put that back together. But from my understanding is, your nerves are all split, and then when they get put back together, sometimes the signals are not going through from the brain and talking to the bladder. Or for me, my brain wasn't talking to my left side from the waist down. So my left leg muscles, mainly in my calf, completely atrophied because it's not getting a signal, and there's no amount of exercise or anything that can build that calf. Same thing with my foot. A lot of nerve damage, so loss of sensory. I think you could probably cut off my pinky toe and I wouldn't know.
Oh.
So I've had some work done on that to correct it. And with my back as well. So I had surgery at birth, and that was to correct the defect. And then when I was 9 years old, I had a tethered cord. So I had what was called a laminectomy. And then that's when my surgeon fixed the spinal cord, and so that I wouldn't go paralyzed, basically. That's what would happen. I haven't had a whole lot of issues since then, other than back pain, fatigue, and the issues that surround the bladder and bowels. So mentioning earlier, catheterizing happened when I was 3 years old, and for many years. I wouldn't have known how to sit on a toilet and urinate. It just wasn't a possibility for me. Um, so got very used to having catheters, and with that, there were some accidents in between.
Okay. You mentioned something about your brain not getting messages to parts of your body. Is that part of the bladder issue? Like is
Yeah. So the bladder is it's neurogenic bladder. I think I'm saying that correctly. So the nerves surrounding the bladder, or however that works, just wasn't getting the signal. So I couldn't tell my brain, okay, you're sitting on a toilet, it's time to go. The bladder just wasn't receiving the signal.
You mentioned in an earlier interview that your self-catheterizing resulted in you experiencing multiple UTIs, which possibly could have led to your bladder cancer. Can you tell us a little more about that?
Yeah, so throughout my life, I've had multiple UTIs. Sometimes I think I had them and they weren't even treated. I would try to flush them out with water or just drink lots of fluids because I was on antibiotics for years. Actually, at one point in my life, I was on a regular antibiotic every day. It was called Bactrim, and that was to prevent infections. But then after years of using it, I just got immune to it. So I was taken off of it, and then I just continued having UTIs throughout the years. I think a bit of the issue was because I reused a lot of my catheters. Um, they're very expensive and they're supposed to be one-time use, but I tried to stretch mine a little bit further, and that's possibly the cause of UTIs, but there's also just a cause of constantly reinserting a tube inside your urethra. It just interrupts it. It causes inflammation, and that would also cause the UTIs. So there's a few different reasons, but most people that who either have spina bifida or they have to rely on catheterization are pretty prone to UTIs. It's a very common in our group.
I think it's important for us to share here that using a catheter does not mean that you will get bladder cancer. Many people will use catheters during their lifetime and not get bladder cancer. And for many of these people, not using a catheter is simply not an option. However, according to the Coloplast website, as of 2020, Canadian urologists and nurses recommend single-use intermittent catheters. Furthermore, according to the Coloplast website, intermittent catheterization can add up. Catheterizing 6 times every day equals over 2,000 catheterizations a year. We know this can add up financially too. Balancing the financial burden and frequency of catheterization leads many Canadians to reusing single-use catheters. Reusing catheters may lead to a change of physical properties of the catheter material, and there's a risk of introducing unnecessary bacteria contamination, which may result in urinary tract infections. Reusing catheters can also be inconvenient and cumbersome. Angela, what has been your experience in this regard? Were you ever required to reuse your catheters?
Yeah, I always reuse my catheters. Actually, when I was younger, my mom was taught to reuse them by cleaning them with sunlight detergent. So after every use, she would clean it with sunlight detergent and then put it into a clean butter container. And then at the end of the day, that butter container would get filled with water and put in the microwave. Literally, that's how we were taught from my doctors on how to keep it clean. So I adopted that as a teenager as well, because that's how we've always done it. And eventually, catheterized myself as a teenager, you start wanting to make things a little bit more simpler. I cut out the microwaving of it. I cut out the sunlight detergent, and I started just reusing the catheters without cleaning them properly. Whether that was properly or not, I'm not entirely sure. But I kind of stopped doing that. And I didn't toss out my intermittent catheters because they were just so expensive. So I tried to stretch them as long as I could. And, I'm pretty aware that I was probably having a lot of bacteria. It was probably, like you mentioned there from the website, it was definitely entering the bladder that probably wouldn't have if I was just using my single-use catheter. But their website mentions about 6 times a day, and that adds up. Realistically, someone with spina bifida who is worried about having accidents, they're worried about how much fluids that they've had that day, how much water, how much coffee. 6 times a day is very generous. I would think mine was much, much more than that. More like every hour to 2 hours versus every 4 hours that's recommended.
And for you, and I think for a lot of Canadians, you have to pay out of pocket for your catheters. They're not covered under OHIP or, well, not.
They're not covered under any provincial health insurance or private insurance for that matter. I've had private insurance my whole life from jobs. Catheters have never been covered, and I've been paying them out of pocket my whole life.
And for you, let's say you needed to use 10 catheters a day, what would be the average cost per day for you?
So that would be equal to about $10 a day, and that is me finding some more affordable catheters online that maybe are a no-name brand, or maybe they don't have as good of packaging, so that was probably the lower cost end at $1 a day.
Wow.
Or sorry, $1 per catheter.
$1 per catheter. So at $10 a day, you could be looking at $300 a month minimum.
Yes.
Which works out to thousands of dollars a year that you're out of pocket for.
And that's hard to do. So you try to stretch it longer than a day. I sometimes went a week to 2 weeks thinking that it was okay, but maybe it wasn't.
Well, it's interesting because your doctors showed your mother how to sanitize them so that you could reuse them. And it's kind of not the same thing, but I think about when you have your daily disposable contact lenses, right? You're supposed to wear them one day and get rid of them, but nobody does because it's so expensive.
Right. Yeah.
But this has bigger content.
Same idea, and of course, I've never been told that there was a lot of risk to it. I mean, you hear that, if you use it too much, you might get a UTI. I was getting them all the time anyway, even when they were thrown out. It just seemed like that was way of life, to be honest. But you weren't really, I don't think I was really told the risk that could be behind it with me reusing so much.
That's good to know, and I think that's an important message for today too. Is for people to understand and to be educated about not what could happen if they reuse their catheters, but a potential risk, a
potential risk.
Yeah.
I think it's something that needs to be, like I said, you're not to scare anyone and say, okay, you're catheterizing now, you're probably going to get bladder cancer. I don't think it's like that. But I do think there's some kind of connection. I do think my constant use in UTIs, inflammation in the bladder, and possibly reusing my catheters led to a lot of this. I was 38 years old, diagnosed with bladder cancer. I didn't have all the other risk factors, working with chemicals or the different things that would cause bladder cancer. So for me, this is what I think my connection to it really is. I think it was because of, the spina bifida leading to having to be catheterized, and maybe not the catheters themselves, but the UTIs, which are, often caused from reusing.
Right. So it's a cycle. It's
exactly.
Let's Let's talk now about your bladder cancer diagnosis. I know this is a story you have told many times, but it's a story worth repeating because I really feel like it has the potential to help so many. Can you tell me about being diagnosed with bladder cancer?
Yeah. So it was August of 2019 that I noticed a fairly large blood clot in my urine. Immediately made a doctor's appointment because I've never seen that before. And I'm pretty, just hearing my story, I'm pretty in tune with my bladder and everything that is revolves around urinating. I knew it was something that was wrong. So I was first treated for a UTI, and I still had all the symptoms, blood clots, pain in my bladder, some pain in my kidney. And I went back to my doctor again and said, I think it's more than this. Um, so they sent me for a cystoscopy pretty quickly, which is great. I mean, maybe it was because of my history of having UTIs, and because I didn't have to fight to get this test done, which I know some people have. They don't fit that little box that bladder cancer is. So maybe they wouldn't get sent to it as quickly as I did get the appropriate test. So by November 2019, I was diagnosed, and I don't know. I wasn't really surprised. I was looking up bladder cancer before then. I thought I had it, and I mean, I guess it is still the shock because when you hear the words, it's a shock. I was at work, I was at my desk, and I scribbled it on like a post-it note, like, you know, bladder cancer. And I'm like, I remember my coworker came in and I started crying, and I'm still on the phone, and I'm turning this note around to her, and I'm like, it's me. I have cancer. you know I left work right away that day. I wasn't sticking around. It was pretty emotional. I called my mom and dad because, well, that's what you do. You call your mom and dad you know
And so many people remember that moment so clearly when they hear the words, you have
yeah,
cancer.
yeah. um, and I actually still have that post-it note. um, at first it was low grade, so my urologist was trying not to alarm me. I think, like, okay, you have low grade, um, so we'll take the next step. She seemed so calm when she was telling me. So even though I was like sad because you still heard the C word, like you still hear it, but I was like, oh, low grade, okay, this is pretty good. Like, we just, what's the next step? And I went to my boss and I said, I'm probably going to need some time off because, I think the first thing they do is kind of go in there with a scope and see what's going on and what needs to be done. I said, don't worry about it. It's low grade. Like, I think I'll be fine. Um, by the second scope or cystoscopy, it was high grade. So it went from low grade pretty quick. And they might have even think that, like, maybe just like never had enough sample of the first time, because it came back like high grade
Right.
after that. So that's when the things kind of changed a little bit.
Even
My dad had prostate cancer and two of his brothers have prostate cancer. Like, currently, two brothers have it. My dad had his prostate removed and was fine afterwards. No additional anything needed.
so that's interesting to think, right? Like, was your bladder cancer from the UTIs or was it genetic, right? And
Exactly.
then if it was genetic, I know you mentioned you have a sister. So what about your
Yeah.
sister? Should she be getting
Yeah.
tested?
Two sisters, actually, both who complain about having bladder issues, but not, I guess it's maybe like many women
Yeah.
do sometimes have it. So, but still, it'd be something then so that they wouldn't dismiss it.
Right.
No?
Yeah, for them to be on high alert so that if
Yeah.
they experience the symptoms of bladder cancer,
Mhm.
then having that history in your family, then maybe they will be, elevated to more urgent testing, right?
Right, exactly.
When did you find out that your bladder cancer treatments, including BCG, were not working? How did you feel when you heard that your cancer had advanced and become more aggressive?
Um, so when we started, like I said, so everything started for me January 2020. I had my first tumor removal surgery. After that is when we started BCG treatments right away. And I had 6 rounds of treatments once a week. And so 6 weeks following that, we went back for another cystoscopy to take a look. And I still had, I had a tumor and I had carcinoma in situ. So there was more scraping required, more removal. So we went back in March to do that. And then once I was healed from that, I had 3 more rounds of BCG treatments. They allowed me to heal again. I think it was probably 5 to 6 weeks in between. I went for my next cystoscopy and it looked worse. There was more inflammation. There was more CIS. So at that point, I was being watched, but getting it removed. And then my doctor was saying, okay, so I don't think the BCG treatments are effective for you. They were going to set me up to do some more like maintenance ones to see how that would go. But for now, they were going to do the surgery, give it some healing time, go back in, see what that looked like. And each time, of course, take biopsy with it. So it wasn't until after my 4th surgery of doing that, which was basically all of 2020. It was like every 3 months, kind of how it happened. The last biopsy that came, my doctor called and said, this one's it's now muscle invasive. We can no longer do, keep going in and removing. It's gone past that point now. So the whole point was try to preserve my bladder. Of course, I didn't want my bladder removed, and that's usually what you try for in the beginning. BCG is usually pretty effective. So it wasn't until I think that 4th surgery and biopsy that we realized, okay, the BCG obviously didn't do anything, and now muscle invasive. The only thing we can do now is remove it. There is no other options. Yeah, I don't even know if I was sad. I think I was a bit angry. Like I was a bit angry, and I haven't been angry about my cancer diagnosis. Not at all. Never ever thought, why me? Never came across my mind. Didn't go through the stages of grief. Didn't feel like I needed to. I didn't have that component, that anger. But I was a bit angry about this. It's like, oh, God, I've been fighting this like for over a year now. I don't want that bag on my side. I even tried to prepare myself. I looked at, I was following some, women or girls who are very attractive, very fit, and they were proudly showing off their pouch. And I couldn't accept it. I was like, I don't want to be that. But I didn't even need to think about it after, because as the conversation went on, he said, okay, you need to go for chemotherapy before your bladder can come out. So my mind just switched. I was like, okay, so chemo's the next thing. Okay, so I'll deal with chemo. So I never actually really, it wasn't until after the chemo was done and we were getting set up for my surgery that I started thinking about the uroscopy. Because my urologist said, he was like, so how do you feel about now having to have the urostomy? And I said to him a couple times, I actually don't think about it yet, because that's future. Right now I'm dealing with chemo, so we'll just deal with that. And that was probably a good thing, because that little bit of anger that I had for a second, it went away. Like, it got met with, a little bit of challenges and stuff when it was done, but I wasn't angry about it anymore, just had to do the next step.
So many of us know that receiving a cancer diagnosis can truly be a scary thing. As a cancer survivor myself, I know that feeling all too well.
Mhm.
But I'm imagining that it's a completely different kind of fear when you hear that your cancer has become more aggressive and that more drastic treatment is required. Can you talk a little bit more about that?
Yeah, if you read a lot of the stories of other people, they say, oh, bladder cancer is like a lifetime. You might be going in for your tumor removals um, every 6 months, yearly. You might do that for 6 years. That's your life now, but you get used to it, sort of thing. I thought that might have been what it was going to be for me. I've read tons of those stories, and I read tons of stories of people saying, oh, I just finished my maintenance rounds of BCG. Everything's good on my last scope. So, yeah, I thought that maybe, okay, so my life was going to get a little bit harder, maybe more appointments now, more surgeries. But, I didn't think it was going to get to the aggressive muscle invasive. I don't know why, because obviously after each scope, it was coming back and it kept returning. But I've read those stories from many people that it's often recurring. That yeah, you're gonna have to. This is like a lifetime thing now. And I thought, okay, well, I can do this. This is so you go for a procedure every few months. Um, I didn't think it was going to change so quickly. Um, all less than 2 years, barely over a year actually, that it became muscle invasive. That wasn't the stories that I was reading online.
Mm.
Yeah, so that was different. I'm like, okay, so I wouldn't say that I wasn't prepared for it because you always know that it's a possibility. But yeah, I was reading a lot more stories where people went, or even some of the people that had to get their bladder removed. It seemed like they were fighting it for a few years before they got there. Mine seemed to go very quick. Yeah.
Yeah, a lot of what I've heard and what I've read is removing the bladder is a last resort, and it's only because it's come back
Yep.
over and over and over again. And I've heard doctors too that have described almost like bladder cancer. It's kind of like in a gray area where it's not like it's a cancer, but it's not a threatening cancer. Like it's
Mm-hmm.
easily manageable, right?
Yeah.
By scraping
If
the
it's in the lining,
yeah,
easily manageable. Yeah.
yeah, yeah. But it just goes to show that it can be aggressive, it can be deadly. You have to
Again,
be on top of it.
I have a friend that well, we are only friends online, but we met because of going through the same thing. He's exactly my age. His bladder was removed before mine because he never even had a chance to go through like BCG treatments and whatnot because it was such a high grade muscle invasive when it was found. Um, and after they removed it and everything else, they found spots in his lungs. So now he's getting immunotherapy to deal with it. And he's a 39-year-old who like had no idea. For him, it happened very quickly, and it could be a scary ending.
Hmm.
You know.
Yeah, we hear a lot about metastatic bladder cancer and how
Mm-hmm.
we have a board member who when he was diagnosed with it being in his lymph nodes, his medical team gave him 18 months, and he, like your friend, he, pursued immunotherapy, participated in clinical trials,
Mm-hmm.
and he's alive and well today. But a big part of that is absolutely advocating for yourself. And I think too, when I think of yourself and your friend as well, there has to be an awareness out there that it can happen to people that are in their 30s or
Mm-hmm.
younger. Of a person out in Edmonton that was diagnosed in her 20s. There's Mateo
Wow.
in Ottawa that was diagnosed at 18 months old. So it's not impossible to get it at a young age. And I think
Mm-hmm.
I think it's so important for people to be aware of the symptoms of bladder cancer and then to advocate with their doctors and say, I know I don't fit the profile. Like you, in your situation, you were telling your doctor,
Mhm.
I think it might be bladder cancer. And even
Yeah,
if you didn't fit that profile, you did fit the profile because you have bladder cancer.
yeah, yeah,
Um,
yeah, exactly. There's no just one set rule for this. Not how cancer works.
hmm.
Yeah.
Um, you've talked a lot about Bladder Cancer Canada and the support that we've provided for you during your diagnosis. You and I first met when you submitted a photo of you and Dexter during a connection challenge that Bladder Cancer Canada was doing on social media in the early days of COVID. But I know that you had been familiar with Bladder Cancer Canada long before that. Can you tell us a little bit more about your experience using Bladder Cancer Canada's free programs and support services?
Um, yeah, like you said, I did find it a lot earlier than than when I sent him that picture. I think it was uh, probably one of the first sites that came up, by the way, like when you search for it, like Bladder Cancer Canada is, it's there, it's ready to go, sort of thing. That's good because sometimes things get buried, right? In the internet world. Um, so I found it, and I think I just went through everything on the website. Whatever I could read, I read through. Um, I said this in an interview a while back. I didn't take advantage of all the things like peer support. There's a few programs that I didn't, um, but that's mainly because I'm a little bit of an introvert myself. So if you have pre-recorded videos, that's what I want to see. So I kind of checked out the videos that were up there, or reading people's stories, that sort of thing. So eh, I think, for one, you have a great site. It's easy to navigate. And for anyone who's coming in and they have questions, I think they can easily get their answers from your site, and that's good as well. You don't want to just have resources and information there and people not know how to get to it.
I just want to point out here that you have the unique perspective of using our services, specifically our patient guidebooks, as both a non muscle invasive bladder cancer patient and then as a muscle invasive bladder cancer patient. This is actually something that you have in common with our co founder, David Gutman. Can you tell us a little bit more about having information on muscle invasive bladder cancer ahead of time and how that helped you through your subsequent treatments and outcomes, including adjusting to life with your ostomy pouch?
Yeah, so yeah, I've read through all the guidebooks, like I said, even the ones that didn't apply to me, because I didn't want to bury my head. I wanted to know what this could be. So when I read through the muscle invasive, even though, like I said, it didn't apply, when it came to my time that it was, I did know what to expect. It's a lot more comforting knowing um, what the future might hold, knowing what a urostomy looks like. You even on your websites, you have the procedure, what it looks like, which parts of your body is going to get removed. That's something that's good to know, especially how sometimes when you have your appointments with your doctors, they can be quick. Um, Not their fault. They're busy. They're running from appointments to surgeries to especially urology because they cover their office work plus they're the surgeon as well, right? So they're busy. They're very busy. Um, so you might not get a chance to ask the questions in those appointments. So your doctor can explain it to you, but sometimes you're not taking it all in anyway, because it's so overwhelming with this new information that even though, yeah, your doctor's saying this and this and this is going to happen, you walk out from that and you're like, what did he say? So having that information from the guidebooks and knowing before my doctor told me about it, when he talked to me about the procedure, I could follow along with him. I knew the words that he was talking about. I knew the medical terms. I was able to follow that a lot easier. And I think it's because of already reading up on it. And I think that's important. Like if you want your mind to really take it in, the more you know about it, when your doctor's telling you, yeah, you're probably going to get more out of it. Yeah.
We like to say, and we have something on our social sites that says knowledge is power. And the more information you have and the more knowledge you have, the more powerful you're going to be.
Absolutely. Yeah. That is 100%. Yeah. So it's, I would tell people, like, maybe if it doesn't apply to you and you're afraid of knowing what may or may not be, don't be afraid of it, because it's going to help you in the long run if you get there. It's going to be able to prepare you easier. It's going to be able to, simply the fact that you're going to understand what is being told to you easier, like the most intelligent person can sit in there and think, but once their anxiety comes in or emotions get involved, or the brain can just shut off. It can blank it out so easily. But if your brain already has a little snippet of what they're talking about in there, maybe you can get through that bit of fogginess of emotion when you're hearing it. So I don't think anyone should be afraid of knowing what the future may or may not be, Read through the whole site.
There's actually quite a number of people on Instagram with an ostomy. People share photos of their pouch, and for many people, they've named their pouches. It's quite fascinating to see, and I think it's really helpful in normalizing having an ostomy. It's certainly educating the public on this. Can you tell us about your ostomy pouch? I think you named her Beatrice, if I'm not mistaken.
She's named Beatrice. Yeah.
Beatrice.
Beatrice. Yeah. Makes sense, right?
Yes. Now it makes perfect sense. When I heard you say it, I was like, Beatrice or Beatrice?
Yeah, Beatrice, yep, the urostomy pouch. I tried out a few names the first few days. I did it early, only because I did see it on social media. I've seen other women say what they've called them, and I thought, I have to do that too, because I want to have a positive attitude towards it. That's always the goal for me, and I've seen other people do it. So I think they wanted to name mine. I tried out a few things and said, I gotta go take care of whatever, and nothing worked. And then my husband actually came up with this. I don't even know how it came about, but he said Beatrice, and it clicked. It was like, oh, she is absolutely Beatrice. That is definitely what she is, especially for a urostomy, of course. I'm glad I did, because I refer to her as Beatrice all the time. I need to go take care of her or that sort of thing. And not that I need to say that, because anyone can just go to a washroom, and you don't need to announce to the world that I'm going to the washroom or I'm going to empty my urostomy pouch, but I like it. I like her having a name. It's a fun way of looking at it, puts a bit of a positive spin, and the name is so cute. I mean, it's great.
It's a fantastic name. It's a fantastic name and very, very appropriate.
Yeah.
And I remember too, you had talked before about the significance of Beatrice and what she represents. And if I remember correctly, your doctor helped you understand that she represented life for you.
Yes. Yeah. Yeah. I've been quoting it a few times now, because it's just so ingrained in my head now, those words. I literally remember, again, this is probably about a week after I'm home from the hospital, a few days in still. So now it's new being out of the hospital, dealing with a urostomy. So it was like completely different than the environment. I had nurses there that was changing it for me. I didn't have full responsibility of it while in the hospital. So he called a few days after I was home, asking me how I was doing. I remember I was sitting in my closet my little dressing table sort of thing. And I was saying how much I was struggling, because at that moment when he called, I was trying to pick out an outfit, which I've been saying is one of the biggest challenges with it. And yeah, when he said, you just need to remember that that bag is on your side because you didn't want to die from bladder cancer. And he said it so absolute. It was just, yeah, it completely switched for me. It was like, no, this wasn't an elective. I don't have to have some like buyer's remorse or regret, or those things that you may have when you're not sure if you made the right choice. This wasn't a choice. Completely changed my perspective. Yeah, I was like, okay, stop feeling sorry for yourself. Like, what are you going to do about it?
That's amazing. It's amazing to hear your perspective and how you're looking at it that way. Can you maybe take a moment to speak to our audience and tell them how their donation will help and what it could mean for bladder cancer patients and survivors?
Yeah, I've said it in other interviews before, but I'm grateful and just so happy that I came across your site. When you can have all the support in the world from your family and from your friends and everyone around you, but no one really knows what you're going through when you have a cancer diagnosis. And specifically for bladder, because you can go online and you see things for breast cancer everywhere, or different types of cancers. They're talked about more, and there's just more resources out there. There's more personal stories out there. Like, you can almost come across any site and find someone who has a story. But bladder cancer was different. I didn't feel like there were so many resources, even for urostomies. The resources aren't out there. There's a lot for ostomies. It's more common, but not so much for a urostomy. It was nice to have that connection with other people who understood what I was going through. And it was nice to have this one source of information that I can go to, that I know was legitimate, that I know that, there was facts there was research done, it was Canadian, which is pretty important to me as well. You want it so close to you as possible. I don't know if I know how to explain this, but it was I didn't feel alone. I got a diagnosis through COVID, so alone. I went through chemo by myself the whole time. I went through surgeries by myself. My husband wasn't allowed inside the hospital, let alone my room. Really did it all alone. So to have a site, a network of people that I can go to that understood what I was going through is just really important. Yeah. And I just think it's important for Canada to always have this source of information for people with bladder cancer. I see a lot in the UK. I'm not sure if they have, I need to look at the stats or something, but it seems like they have a lot of resources in the UK when it comes to bladder cancer and urostomies. I see tons of information out there, but I don't want to go to their site and see if I can get that treatment, because it's probably not available in Canada, or what they can get is probably, there's so many things. It's important that it's in Canada, because it's important that I read and look at it and see what's available, that I can actually attain it myself. There needs to be a presence here, and you guys have that presence, and I don't think it ever needs to go away or should go away. I'm glad that I can help with this, because it is important to me. I feel it in my heart, like in my gut, that I need to, get the story out or something if I help someone. And again, it's needed. It's the resources needed. I think you guys been saying that, it's the fifth most common, but so underfunded. Why? Why is it that way? What's the reasoning behind it? So if I got to share my story a few times and it helps, and I hope it helps. And, and I said that yesterday in the wrap up party, like it also gave me a platform that I don't think I would have had. I'm not the person, like, I don't think I would have just went on Facebook and said, I have a cancer diagnosis. It's not my personality to do that, but because you guys have a reason, there's purpose behind it, and it gave me that platform to put my story out. I think that's been really, really good for me, like extremely therapeutic, especially given my history where I've always hid my disability. I'm glad that I didn't hide this. How would I have been on the inside? How would I have dealt with it if I hid this part of me? And I'm not going to be shouting it from the rooftop when it comes to it, like on Facebook. It's just, but with purpose, I will, you know?
One piece of feedback that I did want to share with you is a couple of weeks ago you did an interview on the radio, and I circulated it to our board of directors.
Mm-hmm.
And our incoming chair of the board, Michelle, she sent an email back to me, and basically she said, I've been observing Angela's journey from afar, from the get-go, from the day we posted your photo with Dexter to, the interviews you've done with Global, how you've talked on the radio. And she said, your confidence in your diagnosis is incredible. Like, she has seen your confidence levels just go through the roof. So you talk about your bladder cancer in a different way than a year ago. Like you own it. Like it's like you own it.
Yep. And see, I think that's thanks to you guys. I really do, because I don't think I would have been able to. I wouldn't have been able to go through all of that and share my story. And the more you say things out loud, the more you're accepting of it as well as a person. Like you're accepting the words that are coming out of your mouth. You're accepting your story. I think that's thanks to you guys that I've been able to do that and look at it with this positivity. But I'm glad. Thank you for that feedback. I'm glad that she seen the strength, I guess, and the improvement.
You have become a bit of a legend in our organization.
Oh,
everybody knows your name. Everybody knows Dexter.
That makes sense. He's literally making, by the way, again, right by my side.
Awesome. Of course he is.
Yeah. Oh, that's nice. See, that makes me feel good. Like that gives me, for one, it gives me a little bit of a confidence that you kind of lose when you give up work, when you give up this life that you had, and now you have a different life where you're in a hospital and looking different, or it gives you some confidence, and that's also needed. I mean, everyone needs a bit of confidence.
I think the people that will be listening to this will hear that confidence in your voice. And I think for anybody that's going through something similar, if they're feeling scared or unsure of themselves, I hope you're going to inspire them to know that they can get through it the same way that you did, with a lot of grace, with a lot of grace and elegance, and just a good attitude and so much positivity.
Thank you. That's good to hear, because I feel like that's how I've done it. Like I feel like this 2 years, that's how I've approached all of it. But it's good to hear that it comes off that way as well.
So Angela, I want to say thank you today for joining us. You always talk from the heart. You talk so openly, so candidly, and it's truly, for me, it's always a pleasure to chat with you. I know in my heart that your story is going to help a lot of people. So it is with so much gratitude that I thank you today on behalf of the 80,000 Canadians that are living with their diagnosis, and also the 12,000 people that will be diagnosed this year. So on behalf of them, I just want to say thank you today.
Oh, you're very welcome. I hope that I can inspire those, like you said, those 12,000 that are going to be diagnosed. I hope that I can give them some inspiration, because you can get through it, you know. So thank you for having me, and you know, all the times we talk. I really appreciate it.
Since recording this podcast interview late last fall, the numbers have changed. We know now that 12,500 people will be diagnosed this year with bladder cancer, a slight increase from the 12,000 that we referenced just a few moments ago. We've also received new information that's telling us that bladder cancer is becoming more common in women than it ever has been before. Bladder cancer in women has increased from being 11th to being the 8th most common cancer. And we learned that recently from the Canadian cancer statistics. At Bladder Cancer Canada, we're doing everything we can to increase awareness of this devastating disease to as many Canadians as possible. Bladder Cancer Canada's mission is simple: to support patients, increase awareness, and fund research. You can find out more information about bladder cancer, our organization, and webinars by visiting our website at bladdercancercanada.org. Please join us in making our vision a reality, a world where bladder cancer is just a memory. If you enjoyed today's podcast, help us make a difference. Consider making a donation at bladdercancercanada.org. We commit to using all funds in a responsible and transparent way, ensuring that your donation helps people in their fight against bladder cancer. Thank you so much, and until next time, I am your host, Tawny Barratt.